work session, Oregon Health Authority Investments in Mental Health and Addiction Services Report.
Madam Co-Chair, while the agency's coming up, so the Oregon Health Authority received some funding for community mental health and addiction services, and there was a budget note requiring them to report on activities related to that funding, and that's what they're here to do this morning.
Thank you.
I don't know.
Okay.
Okay. Good morning. Chair Nathanson, members of the committee, my name is Karen Wheeler, and I'm the Business and Operational Policy Director for the Oregon Health Authority Health Systems Division. And I'm here today to provide a report on the implementation of the new mental health and substance use disorder investments that pertain to the 2015-17 legislatively adopted budget. The written report in a letter format was also sent to you in writing, so you should have that in front of you. The investments include $22 million in new community mental health services and $6 million in new substance use disorder services. We completed a competitive solicitation for rental assistance, and we've committed funding for all of the 15 projects that submitted proposals for those funds. That will purchase an additional 400 slots in rental assistance, adding to the investment from last session, or the 2013 session. That will be a total of just over 900 slots for rental assistance in the state of Oregon. We used fair market rent values. We researched those prior to putting out the solicitation. So there's regional differences in rents, and so those were used to fund the 400 slots. We contracted with the Oregon Health and Science University for the Opal K funds of $1.5 million. So that contract is complete. We also changed the clinical portion of the adult residential alcohol and drug treatment rates. We adjusted those rates from $85.50 to $100 for the clinical portion of the rate, and that is excluding the room and board portion of that rate. So that's an add-on to the rate. So those were adjusted for both the Medicaid fee-for-service program and the non-Medicaid clinical program for people that are not on Medicaid. We distributed $500,000 to Josephine County in October of 2015. The county, in partnership with Choices Counseling Center in Grants Pass, broke ground on the new facility in October, and plans are on target to have an operating sobering facility earlier this year. So that is exciting to many people there, and it's also exciting to us. Unfortunately, the mass shooting incident in Umpqua Community College in Roseburg has caused some delays in working with that community to get those funds into play. We're still working with leaders down there to make sure that that happens. So I can report on that later if you'd like, but we're still working on that. A competitive solicitation worth $250 will hit the Oregon procurement system today for the remaining
$50?
1,000.
Thank you. That was the word that was missing. Thank you.
It's Monday morning. Super Bowl was yesterday. So that solicitation will hit Orphan today and will be available to one or more facilities that want to establish a sobering facility in Oregon. It could be an existing facility or a new facility.
Can I, my apologies, Chair. I had a list of questions I wanted to ask, and I'm being summoned to one of my priority bills is now up right in another committee. I just wanted to clarify, based on your last statement of the remaining funds, at some point we can dialogue more on how we went from $6 million all the way down to $1 million for these centers. But one of my concerns on your last statement about the $250,000 and the competitive process, I'm concerned about how long it's taking to get that out there. Based on the report, it's going to be May, and that's, almost a year after we approved it. And the other thing I wanted to clarify, based on your last statement, are those funds intended for only new facilities or existing facilities? Can both apply to that?
Chair Nathanson, members of the committee, Representative Stark, the $250,000, and we sought some information from leadership before we put together the RFP, is for both new and existing facilities.
Thank you.
And the breakdown of the $6 million, a piece of that, a good chunk of that, was the rate increase for residential. It was $3.5 million, which was directed by leadership here. And then there's a peer-delivered services investment, which I'll talk about in a minute, that is 1.5. So that's the breakdown of the $6 million.
Okay. Thank you, and unfortunately, I will I will watch this later. Thank you.
Thank you.
Okay. Competitive solicitations for both jail diversion and crisis intervention services were posted to ORPN in December of 2015, and those proposals are due this week, February 9th and 10th, respectively. We sought technical assistance from the Substance Abuse and Mental Health Services Administration Gaines Center on criminal justice and behavioral health before we put that RFP together again. We used the basic framework from the RFP that we conducted in 2013, but we wanted to improve upon that and make sure that there was a link and a connection between law enforcement and behavioral health that was very specifically stated in the RFP. So we got some great help from the federal government in doing that, put together a new RFP, and it, as I said, we will be receiving proposals this week. The addictions peer-delivered services solicitation is in the final stages of development. We're just now working on the final questions with the Department of Justice on that for legal sufficiency. That we anticipate that to hit today or in the next couple of days on ORPN. And this is a $1.5 million investment to help establish regional centers of excellence and provide peer-delivered services as well, so that we can really get this service solid and ramped up around the state. This is a service that we talked a lot about during the Ways and Means presentation. And it's something that really helps people to achieve recovery, sustain recovery. It's not treatment, but it really helps people take that next step and be solid in their recovery. So that, we're excited about that, and it should hit any day now. So I think I've covered all the investments. I want to thank you for the opportunity to provide this input and this update, and for your interest in hearing about this.
Yes. Thank you. Senator Devlin.
I'm the latest addition to this committee. Just had two questions, Madam Chair. One, on the $7 million approximately that went to rental assistance,
That's what I heard.
the math on that is about 17,000 plus per case. The language here, speaking of that, is helping with transitioning for people and from various facilities and individuals that are homeless. Is this intended to be, in essence, transitional housing for them, or is this like a permanent subsidy?
Chair Nathanson, members of the committee, Senator Devlin, rental assistance can be more of a sustained or long-term placement for an individual. So it is not necessarily transitional housing. However, when a person achieves recovery, starts getting engaged in the community, goes through supported employment, or is really interested in taking the next step, they can move out of that placement and go somewhere else. But it is more of a long-term placement.
Okay, let's follow up.
Yes.
The budget note that you're complying with, and I know it might be difficult for some of these, and it would depend upon the baseline data that you have and the ability to evaluate that over time. But there's very little in this report that speaks to outcomes. It speaks more to outputs, how many cases you're going to cover, how much you're going to increase the rate. Very little as far as outcomes. In the future, when we put in place budget notes for outcomes, this is a broader question. I think in many cases the agency lacks baseline data to determine what the impact is of investments in this area. Was there any discussion about how you would reflect true outcomes with this report, rather than just merely the output from these investments?
Chair Nathanson, members of the committee, Senator Devlin, I would be happy to come back at some point after these investments have been implemented for a period of time As you know, some of the investments are additional funding for the same type of programs that were funded in the 2013-15 biennium. And I did come to the legislature and provided a report for those funds as well. I can send you that if you'd like. We are collecting reports from all the contractors to get a sense about not only how many people they're serving, but what kind of outcomes they're getting in their communities. We do have some data systems that are also capturing some information that relate to outcomes specifically. And as you may have heard, we are putting together a tool to help us map outcomes as well as services and the kinds of issues that face communities around behavioral health. So there's a collection of data that we're putting together in a more targeted and strategic way that will help us to look at outcomes and help you all as well. So yes, this report is just more about how we've been implementing the money and getting the funding out.
Thank you.
Thank you, Madam Chair. Two quick questions, if I could. The first is, and this may seem counterintuitive in some ways, historically, I think, when we've been working with people struggling with addictions and who have been homeless, the prerequisite for them going into housing has been sobriety and maintaining sobriety, generally speaking, in some instances. I've been working closely with some colleagues in Utah where they're trying hard to address their homelessness problem. Their situation's a little different than ours, so I don't want to compare completely apples to oranges, but there are some interesting things that they're doing, not least of which is not requiring sobriety for placement in housing. And I find that an interesting concept because I think it's very hard to get sober if you're on the streets. And I recognize that, and I think it's pretty easy to have small relapses when you're on the road to permanent sobriety. And that's why we always call people with addictions in recovery, right? And need to support them through that. So I wondered whether you all are starting to think about alternative models where there's a different kind of supported housing for people who are not yet sober and who are not yet prepared to commit to being fully sober and don't want to risk losing their housing because of a relapse, and therefore, if they relapse, may not be willing to seek the help that they need to turn back on the path to sobriety.
Chair Nathanson, members of the committee, Senator Steiner Hayward. Yes, the quick answer is yes, and I'm so glad to hear you say the things that you just said about recovery and addiction. It is a chronic disease. It's not like somebody can just decide to stop, especially if they have challenges and are not, don't have a home. So, absolutely yes, we're looking at different models. I would like to lead efforts so that we have a variety of kinds of models, not only Oxford houses, but other kinds of, housing first models.
Right. And if I may, Madam Chair, quickly. The other question I have, speaking of diversion, and it may be in your full report, which I haven't read, but the part about diversion out of the criminal justice system, how closely are you all working with the new Unity project in the metro area? Because that strikes me as having real potential for diversion, both from traditional emergency departments, which is not really the right place for people in mental health crisis to get care, and from the criminal justice system for very petty people with petty crimes committed in the throes of mental health crisis.
Absolutely. Chair Nathanson, members of the committee, Senator Steiner Hayward, we are working very closely with the Unity Project. In fact, just last week I was on a phone call with them, so there's very close coordination with that project.
Great, thank you. I'll look forward to hearing more about that.
My question for you is related to peer-delivered services. In the letter, the first sentence explains, the agency is conducting competitive solicitation for infrastructure projects in order to build regional capacity for these services. I'd like to understand more about what you mean by infrastructure projects to build capacity. Are we talking about helping stand up entirely new organizations and facilities, or are we talking about supporting and connecting existing organizations and facilities?
Chair Nathanson, members of the committee, it's the latter. We're talking about building upon the efforts that exist and strengthening those efforts and providing regional assistance so that anyone else who wants to begin these kinds of services can do so without having to conduct all the research themselves. We really want a base of knowledge that is building in the communities so that people can provide these services in an evidence-based way and track their outcomes. So it is the latter.
Great, that's helpful, thank you. And I really agree. Other questions? Ms. Ames, could you tell us about your report?
Madam Chair, members of the subcommittee, we just recommend that you acknowledge receipt of the report on the investments.
Madam Chair,
Yes.
move that we acknowledge receipt of the report. Or that we
Discussion.
accept LFO's recommendation. Which motion would you prefer? Okay.
Motion's been made to acknowledge receipt of the report. Is there discussion on the motion? Objection? Motion passes. Do you want to carry it or shall I?
Your choice, Madam Chair. Happy to do it if you'd like. Happy to have you do it.
I will do it.
Okay.
Okay. And I'm any other business on this work session? No, I'm closing the work session. Okay.
No, it's this.
We're ready now to move to an informational meeting. Ms. Byerly.
Madam Co-Chair, members of the subcommittee, so this morning I sent you an email last week with a little bit of background on this item. There was a budget note that was included in the end of session budget bill in the 15 session that discussed rate increases that were going out to some of the IDD providers that were approved in the budget, and wanting some information back from those providers on how those rate increases were being passed along to employees, hopefully in the form of compensation increases. And they're here today to share that information with you. I think they're